These diseases are characterized by itchiness, red skin, and a rash. The area of skin involved can vary from small to the entire body. Dermatitis is a group of skin conditions that includes atopic dermatitis, allergic contact dermatitis, irritant contact dermatitis, and stasis dermatitis. The exact cause of dermatitis is often unclear. Cases are believed to often involve a combination of irritation, allergy, and pore dermatitis, also known as eczema, is a group of diseases that results in inflammation of the skin. Venous return. The type of dermatitis is generally determined by the person's history and the location of the rash. For example, irritant dermatitis often occurs on the hands of people who frequently get them wet. Allergic contact dermatitis, however, can occur following brief exposures to substances a person is sensitive to. Dermatitis was estimated to affect 334 million people globally in 2013. Atopic dermatitis is the most common type and generally starts in childhood. In the United States it affects about 10 to 30% of people. Contact dermatitis is 2 times more common in females than males. Allergic contact dermatitis affects about 7% of people at some point in time. Irritant contact dermatitis is common, especially among people who do certain jobs. Exact rates are unclear. The cause of dermatitis is unknown but is presumed to be a combination of genetic and environmental factors. The hygiene hypothesis postulates that the cause of asthma, eczema, and other allergic diseases is an unusually clean environment. While it has been suggested that eczema may sometimes be an allergic reaction to the excrement from house dust mites, with up to 5% of people showing antibodies to the mites, the overall role this plays awaits further corroboration. A number of genes have been associated with eczema, one of which is filaggrin. Eczema occurs about 3 times more frequently in individuals with celiac disease and about 2 times more frequently in relatives of those with celiac disease, potentially indicating a genetic link between the conditions. Diagnosis of eczema is based mostly on the history and physical examination. In uncertain cases, skin biopsy may be useful. Those with eczema may be especially prone to misdiagnosis of food allergies. Patch tests are used in the diagnosis of allergic contact dermatitis. Atopic dermatitis is an allergic disease believed to have a hereditary component and often runs in families whose members have asthma. Itchy rash is particularly noticeable on head and scalp, neck, inside of elbows, behind knees, and buttocks. It is very common in developed countries, and rising. Contact dermatitis is of 2 types, allergic, resulting from a delayed reaction to an allergen, such as poison ivy, nickel, or balsam of Peru, and irritant, resulting from direct reaction to a detergent, such as sodium lauryl sulfate, for example. Xerotic eczema is dry skin that becomes so serious it turns into eczema. It worsens in dry winter weather, and limbs and trunk are most often affected. The itchy, tender skin resembles a dry, cracked, riverbed. This disorder is very common among the older population. Seborrheic dermatitis or seborrheic dermatitis, cradle cap in infants, is a condition sometimes classified as a form of eczema that is closely related to dandruff. It causes dry or greasy peeling of the scalp, eyebrows, and face, and sometimes trunk. In newborns it causes a thick, yellow, crusty scalp rash called cradle cap, which seems related to lack of biotin and is often curable. There is no good evidence that a mother's diet during pregnancy, the formula used, or breastfeeding changes the risk. There is tentative evidence that probiotics in infancy may reduce rates, but it is insufficient to recommend its use. People with eczema should not get the smallpox vaccination due to risk of developing eczema vaccinatum, a potentially severe and sometimes fatal complication. Bathing once or more a day is recommended. It is a misconception that bathing dries the skin in people with eczema. Soaps should be avoided as they tend to strip the skin of natural oils and lead to excessive dryness. There has not been adequate evaluation of changing the diet to reduce eczema. There is some evidence that infants with an established egg allergy may have a reduction in symptoms if eggs are eliminated from their diets. Benefits have not been shown for other elimination diets, though the studies are small and poorly executed. Establishing that there is a food allergy before dietary change could avoid unnecessary lifestyle changes. Be sure to like and share this video. Thanks for watching.